This is Crystal Fenn with MedPage Today, here in San Francisco at the ASCO Breast Cancer Symposium, where researchers have reported that the age at breast cancer diagnosis appears to be getting younger for BRCA mutation carriers. I spoke with Dr. Jennifer Litton from MD Anderson Cancer Center, who presented the results here.
Well, I see patients who are young women who have a strong family history, and we are noticing not only across all breast cancer patients, but specifically those with known BRCA1 and 2 mutations, they seem to be getting them younger. They seem to be getting breast cancer younger than the generation before them. And so we actually went through and looked at all the women we've seen at MD Anderson who've been diagnosed with a BRCA mutation and compared them with the generation before and noticed that there was a statistically significant difference. They appear to be at least 6 to 7 years younger, both in BRCA1 and BRCA2. The next step that we need to do is then follow the next generation and look to see if the stage, if we're finding the cancer earlier and smaller.
The reasons for the shift aren't clear, but Dr. Litton said that changes in screening and possibly even environmental changes may have played a role.
Well, right now, as part of guidelines, we are screening women at younger ages, or at least 10 years earlier than their youngest family member, but certainly it's something we're going to need to track as environmental issues change, as women delay childbirth, and a lot of other factors that are going on that may increase the risk of breast cancer that might be amplified in women with BRCA1 and 2 mutations. Well, maybe that if someone's already at risk and now there's some new environmental issue or other lifestyle factor that might really come into play with the already high risk, and that's certainly something we need to look at. Women are delaying childbirth, they're having children later, there are several other lifestyle factors that may be playing into this. We may need to look at things like obesity, exercise, diet.
So subsequent generations of BRCA mutation carriers may have seen an earlier age at diagnosis, although the reasons and the implications for treatment and prognosis remain uncertain. Here at the ASCO Breast Cancer Symposium in San Francisco, I'm Crystal Fenn, MedPage Today.